Hello everyone, welcome to Good Morning America Health. I'm Tanya Rivero. In the event of an emergency, CPR is often the crucial component that can help save lives. However, new studies show the techniques long practiced are outdated. Joining us with the latest on CPR safety is Dr. Chris McGovern, ABC News medical contributor and cardiothoracic surgeon at the Morristown Memorial Hospital. Dr. McGovern, great to see you. Thanks for being here.
Great to be here.
So first of all, why are there new CPR guidelines? They've been around so long.
They have been around forever. In fact, 2010 is the 50th anniversary of CPR in the United States. We have saved countless lives with CPR. It works. We know it works. But part of the reason that we're changing the guidelines this year is that we aren't doing a good enough job getting the public involved in doing CPR. And let me explain what that means. 300,000 people collapse from cardiac arrest every year. And most of these occur not in the hospital, but in the public sector. Those that are fortunate enough to get some level of CPR in the field have a chance of living. Those that don't get any CPR will not live. So the take-home message is any CPR in the field is better than no CPR.
And why do doctors think that people have been so slow to jump in?
Well, it's people are hesitant. They're afraid of giving mouth to mouth. They don't know how to give CPR. They think they've forgotten how to give CPR. They're embarrassed. There are a host of different reasons. But the sad fact of the matter, Tanya, is that when someone collapses in the field like this and bystanders are present, only 1 out of every 3 victims gets any level of CPR at all, and that's horrible. And that's the reason we're trying to change these guidelines. We're trying to change them so that people are more encouraged to do CPR, and we're also changing them because we think there's a better way of giving CPR.
All right, so tell us about the new guidelines. I guess I understand, first of all, there's no more mouth-to-mouth, which is huge.
That's a big one.
Yeah.
That's a big one. So we've known for years that CPR involves some component of chest compression and some component of mouth-to-mouth. We know from the recent data that chest compressions are critical, and what's critical about them is that they're continuous. You start and you don't stop. We've also learned that the chest compressions have to be faster than we've been doing them before, and they have to be much more forceful than we've been doing before. Remember, Tanya, when you're doing CPR, you're trying to restart the heart and pump the blood out of the heart, and you actually have to compress the heart between the breastbone and the back, so it's very strong compressions to get it out.
So how do you know what level of power to use? I mean, should you be using all your might?
That's hard. That's hard. Everyone's a little different.
Yeah.
If you've got a big barrel-chested man and you're small, it's going to take more effort. But the rule of thumb is 2 inches.
Okay.
For children, you want to compress 1/3 of the depth of the chest. For adults, you want to go 2 inches. And back to the idea of what we changed as far as the CPR. You mentioned the mouth-to-mouth. We thought for years this was so important, but we've learned it's not anymore. For bystander CPR, it's really not that important. Studies have shown that people do better with just chest compressions alone.
So just keep that going and keep it steady and strong.
Don't quit.
More important than doing mouth-to-mouth.
Exactly.
So can you give us a little demo? What does this look like? What are these new CPR guidelines?
Well, the first thing you need to decide is whether you need to give CPR or not.
Right.
You come up to a victim and then they seem to be unconscious and you don't know. And a lot of people ask me, well, when do you start CPR? It's simple. There are 2 things you look for. Is the victim responsive? And is he breathing? So jostle him to see if he's responsive and assess whether he's breathing. If you have the combination of someone who's unresponsive and not breathing, they're dead or they're about to die. You've got to do something. Get involved. Don't be afraid. Nothing you can do will make him worse right now.
So don't be afraid, because you were saying some of these compressions are so strong that sometimes the chest cavity can crack, correct?
That's right, when you do them properly. So if you're going to get involved, you made the decision someone needs to do it, you need to do 3 things simultaneously. You need to call for help, because you don't want to fly solo, so call 911, have someone do it. See if you can find a defibrillator. These devices will restart a heart that has had a cardiac arrest because of an irregular heart rhythm. They're everywhere. Have someone go find one for you. And then you start CPR. And when you start the CPR, remember, bad CPR is better than no CPR at all, so just get involved. Put your hands up here. You're going to go fast and you're going to go firm, and you're not going to worry about mouth to mouth. You don't need to do it.
Right.
It looks something like this.
And you're putting all the pressure into the sort of the palms of your wrists.
Exactly, and right in the center of the chest.
Okay.
It has to be fast and it has to be very forceful. And as you said, when we do it in the hospital, we break ribs.
Right. Don't
be afraid to do that. This poor guy's dead or he's about to die. Anything you can do will be better than that.
Wow. And how long do you keep it going?
Great point. You do not stop. If you're doing it properly, you're going to get tired. No question about it. You can't stop. If you get tired, find someone that can replace you and continue until help arrives.
And until you see, will there be a visible reaction from?
Well, if they respond or they start to breathe,
doing the right
you know
thing.
that you've done the right thing, and they don't need CPR anymore.
Yeah.
So it's generally a good idea to keep going until someone arrives.
All right, great. Now tell us a little bit about the Lucas that you brought with us. This is something that medical professionals use, correct?
That's exactly right, Tanya. This is really exciting. This is one of the newer devices that we have out that helps us with CPR. It is a portable, battery-operated device that this one is made in Sweden. It's one of 2 devices in the world. It's been available in the United States for 2 years, and it provides mechanical CPR. As you said, it's not designed for the public.
It's not. Okay. Is there a chance that it may someday be available the
Probably
way
not.
defibrillators are? No.
Potentially, but it's a little complicated.
Okay.
The device is strapped around the patient, and this pneumatic plunger is placed on the chest, and when you activate it, it does perfect CPR. It does it 100 times a minute like you're supposed to, and it depresses the chest 2 inches like you're supposed to.
Can we see what that looks like?
You bet.
Wow. Yeah, you can really see how the chest is going down, like you said, the 2-inch depression.
Now, the beauty of this device is not only does this not fatigue, this is a lot stronger than we are. It's got a 45-minute battery. It'll go forever. It actually helps medics in the ambulance setting. If a medic doesn't have to do CPR, he's free to worry about the airway, to start an IV, to give medications, to tend to other injuries. And one of the more exciting features of this is that it's safer for a medic. If you have a patient in cardiac arrest in an ambulance, the patient is strapped into a gurney in the ambulance, the ambulance driver has a seatbelt on, but the medic in the back is leaning over the patient doing CPR.
And could get flung around.
Ambulances can get in accidents, and when they do, it's usually the poor medic in the back that gets injured.
Well, it's helpful for everyone. Wow, Dr. Christopher McGovern, thank you so much for filling us in on these new guidelines. Now I feel like we should all be confident to get in there.
Just get in. That's the important thing.
All right. And remember, for the latest information in the world of health and medicine, head to the health page at abcnews.com. We'll be right back.